a surgeon who had 14-year experience in cataract and corneal microsurgery. Each day, 2 patients from each group were used and the surgeries were performed. Now, all the patients were documented for their best corrected visual acuity, grade of cataract, dilatation, and associated comorbidities. Going on the surgeon's parameter, we used the blood pressure and mean arterial pressure. Along with that, the pulse and SpO2 was used. The surgeon's parameter were documented 30 minutes prior to the surgery and at the end of the surgery. The person who was measuring was unaware which case is getting operated. A 5-pointer questionnaire was used to assess if there is any personal, that is why I was talking about the amended one. Sorry. You can't read, let me help you out with that. The questionnaire was a 5-point questionnaire to assess if there is any personal cause for the stress to the patient, to the surgeon. It included any sleep disturbance, any conflict in the family, if the lady surgeon was having menstrual cycle problem, or if there is any diet problem with the patient. This was just to assess that there is no other cause than the surgery coming up for the stress. Both the groups were significantly similar in the case of gender and age distribution. And if you go into the group 2, there was increase in the systolic blood pressure, diastolic blood pressure, mean arterial pressure and heart rate in single-eyed patient. The questionnaire was same in both the groups. Now, coming to the most important chart, if we go on with the systolic blood pressure and diastolic blood pressure in group 1 and group 2, there is significantly increased blood pressure, systolic and diastolic in pre-op as well as post-op in group 2, which is complicated cases. The similar finding was seen in mean arterial pressure as well as the heart rate. It is proven that heart rate is the most eminent factor to show that there is acute stress. The conclusion is the stress has always been there. It's always been the occupational hazard. But with increasing burnout in the surgeons, this is the area which need to be focused on. Secondly, the physiological parameters have shown a drastic variation in a 14-year-old experienced surgeon. What about the new residents who are operating? This is my bibliography. I'm sorry it was not the amended slide, and sorry for the inconvenience twice. Thank you.
That is okay. That is okay. Complicated cases, we will go under physiological study.
So,
but what is the implication of this study? What lesson it gives?
So the implication is that the patient, when the surgeon is aware that there is going to be uncomplicated cases, there should be some sort of medication or some sort of practice which is involved in the curriculum for the resident and the young surgeons. Because even we know that we are going to go for a complicated case, firstly. Secondly, if we cannot change the patient, at least the environment of the OT as well as the personal factors should be taken care. The surgeon here is a lady surgeon who was also having some problems at the house, which we being female have an over other than the male. So the main area is that we should go for the interventional studies, which can tell which are the factors that can be improved in the OT when we are going for a complicated case. Maybe some musical therapy or something, meditation therapy for the surgeon before a complicated case, especially in young surgeons.
Yeah. That can be there, but not medicine. You say some medicine can be given.
Medicine, I said medication, sir. Medicine we cannot prescribe unless it's a diagnosed case, sir.
Yeah. Okay.